I'm not only a surgeon, but this week I'm a patient, and I'm really excited. Over the years, patients have asked me, have you had breast augmentation? And I say, that's a personal question. I totally don't mind answering it. It's really a personal decision. And I think now that my twins are a little bit older, my practice is, humming along. I feel comfortable taking time away from practice. I feel comfortable taking time away from my family to have surgery and a short recovery, and it just felt like the time was right. And I feel really excited about my decision. I feel excited to walk in my patient's shoes because I help them get through their journey. I really wanted to find a surgeon who would treat me the way that I treat my patients. If I were to have surgery, I would only recommend to you what I would have in my own body. And there's not a one-size-fits-all approach, but I chose to use Natrel implants because I am now walking the walk in addition to talking the talk, and I'm basically treating myself the way that I treat my patients. I want to feel like me. I've had a little, experience with that when I was breastfeeding. I probably don't want to be that full, which is actually good that I've experienced, after you pump or after you breastfeed, your breasts actually change shape. So I've kind of sized out in my own body, and I really want to feel like me. For breast augmentation, there's always a contemplation phase, and that phase usually is a long time. It could be 1 year up to 20 or 30 years. And I know my contemplation phase was a long time. I always knew someday when I was ready, it's something that I wanted to do. I think during that phase, it's important for women to not feel too overwhelmed, to take time and know that there's so many different ways that a breast augmentation can be done. They should try to find before and after pictures of women who look like them from the start and who have a result that they can relate to. They need to do their homework. They need to find a board-certified plastic surgeon who they can relate to, who they trust, who's going to listen to them, and who's going to work together with them to get the result that they're going for. And really, timing is key in terms of when is the best time to have surgery. I tell my patients, you have to have everything else taken care of. You have to be able to take time off work, usually about a week or so. You need to be willing and able to take time off of exercise, usually about 3 to 4 weeks. You have to have support. You have to have a supportive person to not only pick you up after surgery and hopefully stay with you that first night, but other members in your circle that are going to support your decision. And once all those are reached, if it's the right time for a patient, then that's great. Women can be, and they really should be, supportive of one another. Just like, say you're going to have a brand new hairstyle, and, especially if it looks really good, your girlfriend's like, yeah, that's amazing. I'm so glad you did that. Or say you decide to lose weight and get really fit. You want people cheering you on. I think the same thing goes for breast augmentation. If a woman chooses to have surgery, which is a big deal, it's a really big decision, women should be supportive of her, because really all women, they want to look their best. They want to look their best. They want to feel their best. They want to feel feminine. They want to feel beautiful, and we should support one another.
Natrel breast implants are approved for women for the following: breast augmentation for women at least 22 years old for silicone-filled implants. Breast reconstruction. Breast reconstruction includes primary reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. It also includes revision surgery to correct or improve the result of a primary breast reconstruction surgery. Women should not get breast implants who have active infection anywhere in their body, with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, and women who are currently pregnant or nursing. Breast implants are not lifetime devices or necessarily a one-time surgery. If you have your implants removed, you may experience cosmetic changes of the breast, which may be permanent. Breast implants may affect your ability to produce milk for breastfeeding. You should have MRI examinations 3 years after surgery and then every 2 years thereafter to detect ruptures. Key complications are reoperation, implant removal with or without replacement, implant rupture to silicone-filled implants, implant deflation with saline-filled implants, and severe capsular contracture, severe scar tissue around the implant. Talk to your doctor about other complications. Talk to your doctor for more information. Natrel breast implants are available by prescription only.